So today I want to talk to you guys a little bit about dental care, since we have Dental Health Month coming up soon, and everybody always tends to have a lot of questions for me and the other technicians that do the dental cleanings. So I want to try and answer some of those questions for you that are kind of more broad-based that people commonly have for me whenever I call to schedule their dental cleanings. So in this case, this is Cairo, and he needs to have a dental cleaning pretty consistently every year because he has a type of disease that causes him to have a lot of dental problems. And so he gets dental cleanings 2, 3, sometimes 4 times a year to try and maintain the teeth that he has, but also to remove the teeth that he typically ends up having to have teeth removed every time. So one of the things that sometimes you can't see when the doctor is doing the exam and tells you that your cat friend needs to have a dental cleaning, sometimes it's really hard for them to show you the teeth and the gums for you to see how red and irritated the gums and the buildup that are on the teeth already that is causing the most problem for these guys. So I want to try and show you a little bit of what Cairo has in there so that you can see a little bit more of what we're talking about. So oftentimes what Mr. Cairo has is this very red and angry gum line right above where his teeth are. You can see how pink and swollen that is. You can also see some of that brown buildup that's on his teeth. And that's the plaque, just like if we don't go to the dentist, that they tend to get from not brushing their teeth. So that's the part that needs to be removed from his teeth whenever we do a dental cleaning for this guy. So in this case, I've let his dental cleaning go for a little bit longer than usual. So I can definitely see a difference for him. He drools a lot more. He picks at his food a little bit more. And he's a little more hesitant when I go to touch his face. So I can tell that his teeth do bother him. And those are all typical signs when they have red swollen gums or teeth that are infected and potentially need to be pulled. So now that we've talked a little bit about that part, I want to also show you what an actual dental cleaning looks like for your cat friend, so you can sort of understand what the process is that they go through to have the cleaning and the doctor's evaluation of that during the anesthesia. So now Cairo is under anesthesia, and I've got him all wrapped up so that he can stay warm for the next little while he's under the anesthesia. And today we'll have Dr. Allgood, who'll be coming in with her dental probe to check around his teeth first and see if she sees anything that is an immediate concern, so that if there is a tooth that she said yes needs to be extracted, I can already be calling that owner to let them know that there is a problem and we need to discuss pulling a tooth. So typically what happens is I will call her in once he's under the anesthesia and ready to go. And just let her check the gum lines and things like that so she can find any areas of concern at this point.
So we're mainly going to kind of look around for any loose teeth, any big pockets in the gum, areas of concern along there that we need to address for them.
All right, so now Dr. Allgood has done her assessment of his teeth and determined that I can go ahead and proceed with his cleaning at this point, because at this time we don't see that there's any problems or concerns for his teeth. So scaling with an ultrasonic scaler that uses water and high pressure to remove a lot of this plaque from the teeth. You can see it's cleaning away a lot of that dark brown plaque and calculus discharge that he has on his teeth. And I'm really getting up under those gums to try and clean up near where the roots are as well. So already you can tell that there's a difference, even in just the coloration of his teeth. You can see now they look closer to a pearly white like they're supposed to. So now that I've scaled them, I've created grooves in the teeth from scaling, and I need to polish that in order to smooth those rough areas out and keep them from wanting to build up plaque in the future. And rinse away the polish. All right, so now I've cleaned the teeth and cleaned away all the bacteria that are most likely causing all of this gingivitis and inflammation that he's got going on his gum line. So hopefully this helps for you guys to understand a little bit better about what we do when we are cleaning your pet's teeth when they're under anesthesia. Thanks so much.